good morning. My name is Leonard Gaines, and I'm going to be doing my physical assessment head to toe for Darton State College RSN to BSN program. The people that I have assisting me, Tasha will be using the iPad, and Jeremy, he will be assisting me as well as a patient. Whenever you're doing an assessment, the first thing that you want to do is practice proper hand hygiene. So we'll start out by that. Make sure you wash your hands proper amount of time. And you're going to do proper hand hygiene before and after each assessment. Okay. The next thing on doing your assessment, introduce yourself to the patient. Good morning, Jeremy.
Good morning.
All right. The reason that Jeremy is here is for the physical assessment. I would do a general survey of the patient when the patient was coming in the room, watching how they were walking, looking at the way that the patient is dressed. Also, you can determine via the general survey any body odors, etc., etc., etc. So I'm going to go ahead and get a history on the patient. Before doing that, I'm going to walk across the room. I'm going to turn my vitals off. Starting out, I'm going to get vital signs. But Jeremy, how old are you, sir?
I'm 26.
Okay. Do you have any medical issues?
No.
All right. Do you take any medications?
No.
Are you allergic to any medications?
No.
All right. Have you had any previous hospitalizations?
No.
All right. Any surgeries?
No surgeries.
Okay. All right. So that's pretty much a general picture of his health. Are you having any pain today?
No pain.
No pain. So his pain is 0 out of 10. I will add that into my vital signs once I take my vital signs. Tell me about your family, your mother and father. What are their health like?
Father has hypertension, family history of heart disease and diabetes. Mom's side, hypertension.
Okay. All right. Are you up to date on your immunizations?
I am.
The next question, what are you currently doing? What type of work do you do?
I am a nursing student.
Great. Okay. And previous to being in nursing, what was your career like?
I was in the Army.
Okay. All right. What activities did you, what branch, specialty, MOS?
I shot rockets. I was in a tank.
Okay, tank brigade. Okay. All right. What is your diet like?
Pretty poor. Fast food.
Fast food. Okay. For how old are you again?
26.
26-year-old. I can understand that.
Yeah.
All right. And do you exercise?
I do.
How often during the week?
3 to 4 times a week.
3 to 4 times a week. And what do you do?
I either go to the gym or I play some kind of sport.
Okay. All right. Great. So, do you consider yourself in good health history?
Yes.
Okay. All right. Great. So that right there is my history. I've done my general survey. He was dressed in scrubs when he came in. He walked with a normal gait with no problems. The next part of the physical head-to-toe assessment, I'm going to go ahead and gather my vital signs. .1. Pulse rate is 60. 0.02 cent, 97%. $130/89. How tall are you and how much do you weigh?
I am 6'2", and I weigh 185.
Okay, 6'2", 185. That's the other part that you want to gather in your H&P is a weight and a height on the patient. Normally I would have the patient stand on a scale, but the patient has been checked recently, so he knows his up-to-date weight and height. When was the last time that you had a physical exam?
In May.
Okay, great. All right, pulse rate, 60. Nice and even. So what we're going to do next now, we're going to get into the physical assessment. I will place gloves on, and I will explain to the patient what I'm doing during every step. I will stop and answer any questions if the patient has any questions. So put on some gloves. Okay, Jeremy, we're going to start out, and I'm going to stand on this side of the room. I'm going to start at the head and work my way down. Okay, so in examining the head, I'm looking at the head, I'm doing a visual inspection, looking for symmetry, looking at the shape and the size. His skull looks normal, okay? I'm also looking for any swelling, any deformities, contusions, bruises, etc. I will then go to the hair, and his hair is evenly distributed. I'm going to part the hair, and I'm going to work my way to the front, and I'm going to be looking for any swelling, any redness, any discolorations, any organisms, i.e. lice. I will come down looking at the forehead. At the forehead, it's even. Looking at the eyebrows are nice and even, evenly distributed. Looking at the nose doesn't have any deformities. Looking at the lips, looking at the chin. Jeremy, what I want you to do, I want you to look at my finger, and I'm just going to check your eyes out. Okay, the pupils are pearl and reactive to light. While I'm at the eyes, I'm just going to pull down. I want to look at the mucosa. It's pink. The lacrimal gland doesn't show any matting, any discoloration. I'm checking both sides. No matting, no discoloration. Mucosa pink color. I'm going to look at his nose now. Jeremy, just lean your head back some for me. I'm looking at each nair. I'm looking for any discoloration, any redness, any discharge, any drainage, anything that might be obstructing the nairs. Both nairs are open and patent. I can also test for patency by asking the patient to just occlude one nostril for me. Take a deep breath out. Okay. Occlude the other. Breathe out. Okay, great. Both nairs are open. The next portion, I want to look at the mouth. And I will use a tongue blade for this portion. Okay, Jeremy, open your mouth. Just use a tongue blade. Say ah.
Ah.
All right, great. His uvula moves. Okay, while I'm having here, I'm just going to take the tongue blade and look at his teeth. Okay, just pull down. All right. He's had some dental work, everything. And I did not note any swelling, any discoloration, any lesions inside of his mouth. Okay. So the next thing I'm going to ask Jeremy to do is just focus in on my finger. Okay. All right. I'm going to bring it in. Okay, looking for convergence. I'm going to bring it back out. Okay, I'm going to ask him to follow my finger. Okay, so I can look at the cardinal point, the 6 cardinal points, which test cardinal cranial nerves 3, 4, and 6. Okay, so just follow my finger with your eyes. And he did follow them. Okay. What I want to do now is that I'm just going to take a look into his eye. I'm going to come in. And when doing this exam, I would turn my light down so I can see it. Okay. All right. And I will be checking for his optic nerves. Okay. Next thing I want you to do, I want you to give me a big smile. All right. That's testing cranial nerve 7. I want you to stick your tongue out and move it side to side. Okay. Moves it side to side without any problem. I don't have a tuning fork, so I'm just going to do some snaps. Can you hear those?
Yeah.
Okay. All right. I'm going to occlude one ear, and I'm just going to bring my voice down to a whisper, and I'm going to ask Jeremy to repeat the words that I say. Big brown cow.
Big brown cow.
Okay. He did not see my lips when I was talking. I'm going to include this one. The little girl with the red dress.
The little girl with the red dress.
Okay. So he passed the whisper test. Okay. So the next thing that I want Jeremy to do is that I'm going to press down on his shoulder blades, and I want him to shrug his shoulders. Okay, great. Okay, now I'm just going to have him clench down like you're biting, testing the masseter. Okay, I want you to turn your head against my hand. Okay, that's great. Turn your hand against my head. That's great. I'm going to palpate for any lymph nodes. Okay, I'm going to ask Jeremy to swallow. Okay, now I'm going to have him lean forward and swallow. All right, checking for the thyroid. The first test just gave me the position of the thyroid. The second test I was actually palpating and looking the thyroid for the size, the texture, and the position. Looking at the neck area, I'm looking at the trachea to make sure that it's centerline. I'm looking for any swelling, any discolorations, any lacerations, etc. Everything looks good here. All right, so I'm going to have him lean forward now, and I'm going to look at his back. I'm looking for the spine to make sure that the spine doesn't have any deformities. Also looking at the skin for bruises, any lacerations, any tears, any swelling, any redness. Just going to percuss, listening for any difference in the sound. Okay. I'm going to listen, lung sounds. Okay, I want you to open your mouth and just breathe evenly in and out. Okay, lean back. Now what I'm going to do, I'm going to pull his gown down. Okay, I'm just going to palpate this area here. Still concentrating on any lymph node enlargement, which I don't feel. Looking at the chest, we're going to just go ahead and look at the breast here. looking for any discoloration, any drainage, any swelling. I'm going to just run my hand down here, just palpating for any objects, any masses. That's normal. That's normal. That's normal. Okay. I'm going to take this off of you. While here, I'm going to assess on this axillary, along the humerus, along the axial folds, for any lymph node enlargements. And I'm going to do it bilaterally. Okay, no lymph node enlargements. All right. So while the patient is here, I'm going to go ahead and start the thorax, my cardiac portion. I'm going to visually inspect for any swelling, any redness, any discoloration. As you can see, we have discoloration here. He has a nice tattoo, but outside of the tattoo, you don't see any lesions, any marks, or whatsoever. So I'm just going to just go for my aortic, which is at my second intercostal, just using the tips of my, or the palmar portion of my hand. That's the aortic, pulmonic, tricuspid, apical. And what I'm doing here when I'm doing that is I'm feeling for any thrills, any type of heaves or lifts, so that's irregular on a person. So now what I'm going to do, I'm going to listen to his heart. Okay, I assess by listening aortic, pulmonic, Erb's point, tricuspid, apical. S1, S1 and S2 normal. There were no murmurs, no regurgitations, so he sounds good. While I have the patient here, I'm also going to go ahead and listen to his carotid. I'm going to do one side at a time. Okay, I'm just going to palpate the carotid pulse. Nice and even. Okay, so now what I'm going to do, and also at this position right here, 30 to 90 degrees, I will look for any JVD, any venous JVD, which is indicates heart failure. Okay, I see no JVD noticed. So what I'm going to do next is that I'm going to go ahead and lie the patient down so that I can look at his abdomen. Expose his abdomen. All right. First thing in doing, looking at the abdomen, I'm inspecting the abdomen. I'm looking for any pulsations. I'm looking at the shape, the size, symmetry. I see no swelling,
no redness, no discoloration, no bruises, no scars. First thing that I'm going to do, I'm going to listen to his vowel sounds. Okay. Looking at his umbilicus, looks normal. Epigastric region looks normal. I will palpate down in this suprapubic area. Also feeling for femoral pulses and feeling for any lymph node enlargements. That takes care of the urinary portion of it. But I'm going to just palpate, or I'm going to percuss first. I'm going to percuss. And now I'm going to palpate. When I'm palpating for any masses, looking at the patient, observing for any pain or discomfort. So I'm going to have Jeremy go ahead and slip his arms back into his gown. Everything looks normal there. I'm going to have him sit up again. Okay. All right. While the patient is here, as I said, I've already checked his urinary portion. I'll also go ahead and ask him, are you having normal bowel movements?
I am.
Okay. Any discomfort when you're urinating?
No.
No discharge, no issues there?
No.
Okay. All right. So now we're going to move on down to the musculoskeletal portion of the exam. And what I'm going to do is I'm going to just have Jeremy stick both his arms out, straight ahead. I'm going to examine his fingers, looking for any clubbing. I'm going to spread and look down between the fingers, looking for any swelling, discoloration, any redness. Do it on both sides. General survey. Both arms look the same length. I'm going to have him turn his palms up, both sides. I notice no discoloration, no redness, no swelling. Okay. I'm going to check his lower extremities now. Okay. I'm looking at his knees, his patella area, looking down the shin area to his feet. Take these off. All right. While here, I'm just going to palpate for a popliteal pulse. Okay. Do both sides. All right. Even. He has hair on both legs going down. No swelling. No redness, no discoloration, no bruises. In this area here, I would also just press down and check for any edema. No edema noted. Check for pulse here, pulse here. It's my dorsopedialis. Dorsopedialis, and my posterior tibial here in the ankle area. Here in the ankle area. And now I'm going to have the patient flex his foot at a 90-degree angle. Okay, I'm holding it up. Are you feeling any pain in your calf area?
No.
Okay, so negative Homans, 90-degree angle, any pain? 90-degree. Okay, so no negative Homans on that. While the patient is lying here, I'm going to check his flexibility by bringing his knees up, okay, and just rotating it out. Any pain?
No pain.
No pain. Stick them straight out. Bring it in. Rotate it out. No pain?
No pain.
Okay. All right. What I want you to do is that I want you to pull your arms in, and I want you to resist. Okay. All right, nice and even. He had I checked his radial pulse earlier. Nice strong radial pulse. I checked his carotid pulse. Carotid pulse nice and strong. Femoral pulses both sides nice and equal. Popliteal, dorsopedialis, posterior tibia. Those are all good. Now what I'm going to have Jeremy do is I'm just going to have him stand on the side of the bed over here. Or sit on the side of the bed, excuse me. Okay. And while he's sitting on the side of the bed, I just want him to stick both of his arms straight out. Okay, I want you to raise your arms over your head. Okay, I'm just looking at his shoulders, making sure that the shoulders move equally. Bring your arms down. I want you to reach behind your back. Reach behind your back. There you are. And just extend. Okay, just looking there. Okay, it's even there. That's good. I want you to stand up. Bend over, touch your toes. Okay. Up. There we are. Good. You can stand back up. All right, good. He's got good flexion. I want you to go to your, lean to your left. Lean to your right side. Okay, good thoracocolumnar movement. You can sit down now. Okay. And I'm just going to check the patella area. Okay. All right, good. Check the tendon area. Okay, good flexing. Patient didn't exhibit any pain. You can go ahead and sit back on the bed. All right. And what I'm going to do now is that I'm just going to do the soft, dull test. And what I will do is that I'll just break this. This will be my sharp point. Okay, this will be my dull point. Okay. All right, so close your eyes, and I just want you to tell me whether you feel soft, dull, or sharp. Okay.
Sharp. Dull.
Okay.
Dull. Sharp.
Okay.
Dull.
Okay, great. With your eyes closed, I'm going to just do it down here in your leg area. You just tell me that. All right. Just tell me whether you feel dull or soft.
Dull.
Okay.
Sharp.
Okay.
Dull. Sharp.
Okay. All right. So basically, that was my physical assessment on Jeremy, head to toe, noting any swelling, noting any type of issues, and that's it.